could it be possible that maybe black people or those of African descent are somehow immune to the coronavirus? Well, the short answer is no.
African Americans make up 15% of the population. They are 42% of the state's coronavirus deaths. In Louisiana, African Americans make up about a third of the population. 7 in 10 of the deaths in Louisiana are African Americans. In Michigan, it's about 14% of the statewide population, more than 40% of the deaths.
Hey, what's up, guys? This is Dr. Enoch Cote, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. In this video, we're going to talk about African Americans and how we've been affected by COVID-19. We're going to talk about why we've been dying disproportionately and what you, yes, I do mean you, could do to play a part in terms of helping to slow down the death rates. So there are many different factors contributing to this, so let's go ahead and get into them right now, one by one. So the first reason we're going to talk about is just the fact that we're sicker and have higher rates of chronic disease in general. So this is something you've heard about over and over again, right? African Americans in this country, we have higher rates of the very conditions that put you at higher risk for serious illness or even death due to COVID-19 infection. So this is your heart disease, your diabetes, your lung disease, and so forth. It's been known for decades that we have higher rates of all these different chronic diseases, and a lot of it is environmental and also just due to lifestyle, poor diet, lack of exercise leading to obesity. Some of it is socioeconomic and some of it is genetic as well. But these factors do exist, and this is one of the biggest things that's actually contributing to high rates of death among the African American population. The second thing that we're going to talk about is just the fact that healthcare disparities are more common among African Americans. So this is something that's also been the case for a long time, and it kind of ties into number one. But the reason why we do have so many chronic diseases is because of lack of access to quality medical care. We're more likely to be uninsured or underinsured. So as a result, you're going to seek medical attention later if you're in your illness, and you might not have access to the same resources to care. Also, if you do get sick, you would be more likely to present to an emergency room where there's a whole bunch of COVID-19 floating around right now. Really not safe to present there. But people might have that as their only choice as opposed to presenting to maybe a more controlled or less chaotic high-risk environment like a primary care office if you don't have a primary care physician. And also, if you don't have a good primary care physician you can turn to, you might not have gotten the same timely advice to, frequently wash your hands often, stay at home, and work on boosting your immune system. Your questions would have been unanswered and you would have just been walking into this battle blindly. Another factor that has contributed to such high rates of death due to COVID-19 among African Americans is social injustice and racial inequities. And yes, we are playing that card because it's long well been documented that institutional racism and discrimination have left indelible marks on our communities. And it's one of the main reasons why a lot of African Americans are forced to live in close quarters in the inner city. And this oftentimes makes social distancing impractical. One of my friends from medical school, Dr. Garth Walker, an emergency medicine physician practicing in Chicago, wrote an op-ed for the Chicago Sun-Times titled, "As a doctor, how do I tell a black family of 5 struck by the virus to social distance in a 2-bedroom apartment?" Now, in this article, he talks about how the legacy of poverty has forced us into substandard housing situations and how segregational practices like redlining have denied us mortgages in certain areas, thus suppressing our opportunities to build wealth. So now what we have today is multiple generations of a family living together in tight housing conditions. So one of the children could have potentially picked it up from school before school closed out indefinitely. And even though they're asymptomatic, still have a high chance of bringing it home to grandpa in that small apartment unit. And guess what? Even if that doesn't happen, mom and dad are more likely to be working blue-collar jobs. So if mom works in a chicken processing factory on a tightly packed assembly line, how long do you think it's going to take before somebody shows up there with COVID-19 and ends up spreading it to everybody else? How long do you think it will take for dad, who drives a city bus, to pick it up from one of the riders who cannot stop coughing but yet cannot afford to buy a mask? How do you think it will go if they ask their bosses whether or not they can work from home? Oh, well, if it's so risky, they should just quit their jobs, right? Well, how else would they buy groceries and eat when they're locked down under quarantine? So it's just a vicious cycle, and blacks in the inner city are really being hit very hard by this right now. Another factor is poor policy making. We should have restricted international travel to a greater extent and even earlier. And really big events that happen around late February, early March, like for example, Mardi Gras in New Orleans should have never took place. That actually reminds me of a story that I had of a patient that I was taking care of in late February, early March, who had recently got back from Mardi Gras, was experiencing cough, fever, shortness of breath. I talked to the health department about them and the CDC, and they recommended against testing because this patient was not in Italy or Iran or China or one of the places considered to be high risk at that time. So they recommended against testing, but now we're finding out later on that probably a lot of infections and transmissions did take place in New Orleans or during Mardi Gras because that city is being ravaged right now by COVID-19. We also shouldn't have dropped the ball when it comes to the expansion of testing. But I know hindsight is 20/20. But that actually brings us to our next reason, or our next major contributing factor, which is the fact that the virus just straight up blindsided us. Most of us have never seen anything like this in our lifetime. Because, influenza or the flu is bad, but it doesn't have this level of contagiousness, especially in asymptomatic people. And now because we have a vaccine, we've been able to effectively lower the risk of death due to infection. There are very, very serious things like Ebola that are very contagious, but they haven't been able to spread globally like this. And then you have things like the common cold, which are very common, but they don't cause death. COVID-19 is the virus with just the right amount of contagiousness, even in asymptomatic people, mixed with a high level of deadliness to completely turn this world upside down and change life as we know it. When something like that comes along, how do you prepare for an unfamiliar enemy? Well, you don't. You fall behind, and that's exactly what happened to all of us. So that's why you got experts that started out saying you don't need a mask, and then all of a sudden turning around and saying you have to wear a mask. Another big contributing factor was just misinformation. At the beginning of this pandemic, a lot of blacks across the world and in the United States thought that black people were immune to coronavirus or COVID-19 infection, or they thought that maybe they can get it, but we weren't really able to die from it. And this is because, the rumor had spread on the internet and in social media, and it kind of just stuck and people wanted to believe it. Some of it might have been also this media coverage because, every day when you were turning on the news and you were hearing specific stories of people being affected by COVID-19 and people losing their lives, you weren't seeing a lot of black faces there. So people just thought that this is something that, could not affect them personally if they were black. Another thing that was contributing to this was just the slow spread in the African continent. They only had like a handful of cases at the beginning, and it took a while before we identified a lot of other cases and a lot of deaths in the African continent. So people just said, oh, maybe it's because of the dark skin that protects them against the virus. And that way, and for that reason, we don't have anything to really be worried about. And we were obviously wrong. And you can imagine how something like that can really contribute to death as a whole. So those are all the major reasons that I've identified for why African Americans have been disproportionately affected by COVID-19 in regards to deaths due to COVID-19. Now, having said all this, there are things that I think that we can do collectively to slow down the death rates and the infection rates in general. And a lot of these things are not necessarily things specific to African Americans, but just to mankind as a whole. So the first thing is advocacy, not just for yourself, but also on behalf of your friends and your family. Don't hesitate to ask doctors questions about the plan of care. No doctor should ever be offended by you wanting to learn more about your condition. If it shows that you're more serious about everything and more in tune with what's going on, there is a chance that you can make sure every possible option is being offered to you in terms of your care. Also, we need to write our local lawmakers and let them know that we need more resources to help control the spread of the virus in our communities, and that any policy being enacted needs to protect our best interests and not that of Fortune 500 companies and large wealthy organizations. Another thing we need to do is take advantage of the resources that are available to us. If you're fortunate enough to have a primary care doctor already and you get sick, make sure you reach out to them and stay in close contact with them so you can get prompt medical attention. Also, if your family is struggling to put food on the table, hit up a local food bank. And if you're lucky enough to get one of those stimulus checks, even though it's not that much, make sure you use it wisely. So the third thing is hand hygiene. This is something you've heard over and over again about the importance of washing your hands and how this one simple act can go a long way in terms of infection control. So it's important that we don't get lax on this because this is something that truly can save a life. Another thing we can do is wearing masks. I know it's kind of confusing because at the beginning, people and some experts were saying, you don't really need to wear a mask. There's no point. And, why get those surgical masks when those could be used for healthcare providers to take care of patients in the hospital and so forth. But now, after thinking about it more, it kind of makes sense that it probably is a good idea for us to wear a mask, right? It's because, any kind of respiratory droplets that could be coming out of our mouths whenever we speak or we cough or sneeze are getting blocked by the mask. And of course, some of it might get around on the sides or on the top or the bottom, but overall, it still can significantly lower the amount of droplets that are being transmitted in public. Another thing we could all do is just try our best when it comes to social distancing. Now, earlier in this video, I mentioned that it's not always practical to social distance in certain situations, especially within a household. But in terms of the general public, there are a lot of different things that we could do to help social distance. First of all, just because you're off of work for the next 3 weeks, it doesn't mean you can have all your boys come over and play a big game of spades, right? When it comes to church, it can wait or be done virtually. Jesus will forgive you. He knows what's going on right now, trust me. And I don't want to get too political, but certain governors and mayors are lifting shelter-in-place orders right now prematurely, but you already know that it's still not safe yet. And that actually leads us into the next thing you can do, which is just use common sense. No need to go bowling and shove your fingers in the holes of a random ball at a time like this, right? Also, if you're going to wear those gloves, make sure that you're not just touching everything in the store and then using those same gloves to touch your own belongings, thinking everything is all good. Because all you're doing is just spreading germs to your own belongings, and you're going to be less likely to disinfect them or wash your hands afterwards because you have this false sense of security because you had gloves on. Another thing we have to do is stop the spread of misinformation. We've already established that basically everybody is susceptible to the virus, so there's no group of people with a stronger immune system than others that don't need to worry about this virus in general. Also, anything that you hear online and in social media should be vetted very carefully, even this video. Also, please stop listening to and spreading conspiracy theories, like, for example, this whole 5G thing about how that's causing the spread of coronavirus, things that don't even make any sense. Whenever you kind of talk about those type of theories and spread them throughout social media and the internet, that's just wasted energy that can go into helping yourself, your friends, or your family, or your community as a whole in a more tangible way. The next thing is just to be open to new ideas. In the coming days and weeks and months, we're going to be hearing about other things coming out, whether it be treatments and vaccines and things of that nature. And I'm already hearing people say that if they come out with a vaccine, I definitely am not taking it, And some of it stems from just the whole fear about, African Americans being experimented on. And, it stems from history. And I get it. I even have a whole video where I address this topic. But it's been well established that a lot of the major viruses that have plagued civilization over the past century have been close to becoming eradicated because of vaccines. So this is your polio, your measles, your chickenpox. A vaccine might be our only shot of really getting out of this and turning back to some sense of normalcy within our community. And a viable treatment that actually works might be the only way that we can actually help lower the death rates due to COVID-19. So as these things are rolled out, don't just automatically count them out because you're scared of some kind of government conspiracy or being experimented on. That also doesn't mean that you just blindly follow whatever's being presented to you either. Don't be hesitant, like I said earlier, to ask questions and make sure you understand what's going on. I've heard of stories about some scientists supposedly saying that we need to test some of these vaccines first on poor people in Africa. So there's a couple things about that. A, that's just completely unethical. But B, it wouldn't make sense from a scientific standpoint either, just because anytime you test any kind of treatment or any kind of intervention, it needs to be tested on a diverse group of people to make sure it's safe and effective for everybody. So if you're just testing on one group of people, that wouldn't make sense, and nothing like that would make it to market. The last thing is to just be unselfish. And you should just keep in mind that everything that you do should not only be done to protect yourself, but to protect other people around you. Let this one principle govern all your actions. Thank you for watching, and peace out.